Hello friends, today we are going to discuss about systemic lupus erythematosus, the diagnostic criteria of that, and we are mainly focusing on the recent changes which have been introduced recently. As we all know, the diagnostic criteria for SLE previously we used to be of SLICS criteria, that is Systemic Lupus International Collaborating Clinical Criteria for the classification of the systemic lupus erythematosus. But now the criteria have been changed to the EULAR ACR criteria. The SLICS criteria have been introduced in 2012 and the EULAR criteria have been adopted in 2019. What are the main difference in the SLICS and the EULAR ACR criteria, and why we have been shifted in the diagnosis from SLICS to EULAR ACR? So just discussing the salient points, the why the need arises to shift from SLICS to EULAR ACR is there was a fallacy actually in the SLICS criteria. The fallacy was that the different parameters which we have set to diagnose SLE have been given the equal weightage, whereas in actually the each parameters have the different weightage. For example, if suppose a patient is having lupus nephritis, then this patient is have been considered to be given 1 point in the SLICS criteria, and similarly the patient who is having non-scarring alopecia, for example, non-scarring alopecia, this is also considered to be as one parameter, and similarly counting the parameters to be 4 or more in the clinical criteria and the immunological criteria, these parameters have been given equal weightage, and that is not true in all the cases. So we can overdiagnose or we can misdiagnose the patients of the SLE with SLICS criteria, and it is less accurate. So now, considering these all features or the findings, now EULAR ACR criteria have been developed. In this, there is no equal weightage, or we can say there is the weightage given according to the specificity of the symptom. More the specific symptom is, more the weightage, or we can say more the points. And if the points are 10 or more, we can diagnose the patient as SLE. So for example, considering the same example, if the patient is having lupus nephritis, so this is put higher, or this is given the high points, and if there is a non-scarring alopecia, it is given a low score or the low points, somewhere around 2. And lupus nephritis, considering the stage of the nephritis, it can be 4, 5, 6 depending on that. And so the what I mean to say is, if the symptom is more specific for SLE, it is giving the more score, and hence the diagnosis becomes more accurate in these cases. Similarly, if we come to the immunological manifestations, in the immunological manifestations, the certain antibodies like anti-Smith antibody, anti-dsDNA antibody, these are very specific and given the high weightage, the score of around 6. So if these antibodies are positive, so we can more confidently can say the patient is having SLE, along with certainly other features if the score is more than 10. Now this is the parameter. Now what are the changes what we have seen? The first change what we have discussed is the specificity, and previously in the SLICS criteria we just have to get more than 4 parameters in the clinical as well as in the lab or the immunological parameters. So if we get any of these, then we can diagnose the patients of the having SLE. Now in the EULAR criteria, what is mandatory is, first we can just a second, I have to rub it. Now in the EULAR criteria, the mandatory findings are, first of all, ANA should have to be positive, and the method of ANA is also specified, though it was previously given also to do how to do the ANA. This time it has been explained loudly. The quantitative method is being used and the qualitative method has been declined, and that method is by indirect immunofluorescence by Hep2 cell line. This is the method to use the ANA, and if the titer is more than 1:80, only then it is significant. We are discussing about the EULAR ACR criteria. Now in the EULAR ACR, this is the finding, this is the must to have, and after that, if we get the score of 10 or more, then we can diagnose the patient as having SLE. In this, one change which is there is of fever. Fever has been introduced this time and has been given a weightage of 2 points. Along with that, one main deletion is that we have deleted the direct Coombs test for absence of hemolytic anemia. This have been eliminated from the diagnostic criteria. These two are the major changes, and rest all parameters are same, except that there are the different weightage have been given in the patients according to the symptoms. So I hope I have made the point clear. Rest of the findings or the rest of the parameters you can easily find anywhere on the net. So if you have any doubt, just please leave a comment or give your feedback. It would be highly appreciable. Thank you.